well, this is what the curve of cases looks like. We've got another 1,288 cases today. If you sort of squint, you can maybe start to make out what looks like it could be a slowing in the rate of growth in this curve. It's sort of starting to look like that might, potentially be beginning, but you kind of have to squint to see it, and I'm not really kind of at this point ready to say the curve look like it's flattening or anything like that, because we've seen how quickly it can then escalate again. But at least we've seen now a few days straight where, these numbers have not escalated. We have seen that before, so let's not count any chickens. Let's make sure that trend does turn before we sort of start, breathing easy, because these numbers are continuing to grow. The hospitalisation pressure continues to grow, and sadly, as we've seen today, more people will continue to die with this virus. 7 more deaths today. 120 cases yesterday has turned into 176 cases today. We have some real growth particularly in Melbourne, in the western north of the city, that's making this thing hard to control, and it's fundamentally why the government has said they don't think they'll be getting back to zero. It's certainly not while the vaccination rates remain where they are. Let me just break down the cases in 2 ways. One, we've got really steep growth in Melbourne. So Melbourne is a real problem at the moment compared to regional Victoria, where the cases are maybe starting to tail off. This doesn't include today's cases. We don't yet have the full regional breakdown of today's cases. We might see some more cases in regional Victoria as people in Shepparton now come up for their day 13 quarantine tests. So we may see another bump, but hopefully that bump will be all cases contained to isolation. And then in Melbourne itself, what's really worrying is a growth in the number of linked cases, but a really a steep growth in the number of unlinked cases. And this does account for those cases that later do get resolved. But the curve there is growing. We have more and more mystery cases, particularly in the kinds of places we've seen it's very hard to extinguish transmission. In Melbourne's case, it's the western and northern suburbs with lots of essential workers, people who can't work from home, and typically lower incomes.
We've also got cases in the ACT, Casey, 12 of them today, and one in Queensland.
Yeah, so the ACT is, another state that has been battling this outbreak for a long time. Hopefully what was hoped to have been a short, sharp lockdown of 7 days is now looking to run for at least 5 weeks. 12 cases today, so significantly fewer than yesterday, about the same as where we were for the previous few days, but a lot of those still out in the community. While infectious, there's a lot of community exposure still in the ACT this far into the Territory's lockdown. We certainly hope these numbers certainly don't escalate and do come back down to zero, but there is that very real chance that this thing is still, Delta is too formidable even for the ACT, where, if any jurisdiction had the best hope of crushing this virus, you would think it might be the ACT, with its higher incomes on average, with lots of people who can work from home. All of those kinds of factors kind of play to the ACT's benefit. Even they're struggling with it, and this thing is continuing to rumble on and on and on. And in Queensland, as you say, a real reminder that even the states that are COVID-free should not presume they will be that way forever, and really need to make sure that they're ready for Delta if and when it comes. One case, a truck driver who's been in the community on the Gold Coast for several days while infectious. We haven't yet heard from the Queensland government, but we'll see what they say later on today about the particulars of that case. And in the coming days, we'll see if there's any further transmission. Certainly we hope not, but the risk of these incursions is real. The risk of incursions from places like hotel quarantine as well is real. And, every state really does need to be preparing for the eventuality, whether it's on their terms when the vaccination rate gets to a certain level and they open up safely in a way that they can control, or if it's by an incursion, Delta is eventually going to make it into the community.
Casey, First Nations Australians were a priority for vaccination at the beginning of this rollout, but you've got some figures there showing that hasn't been reflected in reality.
Yeah, so the vaccination, First Australians were acknowledged as a priority very early on. Needed to be some real work needed to be put in to protect Indigenous Australians across the country from the effects of this disease, and to get them vaccinated, particularly remote communities. So Indigenous Australians over 55, they were in phase 1B of the rollout. All other Indigenous Australians, adult Indigenous Australians, were in phase 2A, alongside people in their 50s. And what we're seeing is that the vaccination rates among those two groups are vastly different. We're talking about 70% plus people in their 50s vaccinated with the first dose, less than 40% among Indigenous Australians. And the gaps that we're seeing between Indigenous and non-Indigenous Australia, they're massive across the country. In Cairns, 10% of this Cairns region is Indigenous. It includes the Yarrabah Shire. We've got 22.6% of the population with a first dose, and that is 30 percentage points lower than the general population of that region. Similarly, in Townsville, in Mandurah in WA, and in Perth, a capital city, has these 30 percentage point gaps between Indigenous and the overall vaccination rate. Really, really big gaps that really do need to be addressed, even in areas with outbreaks. Shepparton, 25% lower. Blacktown, considerably lower as well. And so we have this widening gap among the people who were really supposed to be one of the top priorities. The only place we don't really have this gap is in Melbourne, 28% higher. So we've actually got nearly 90% of people in inner East Melbourne that are Indigenous and age 15 plus that are vaccinated. Geelong, the vaccination rates are looking pretty healthy. The gap in Warrnambool's not too bad. But Victoria is the outlier here. We have, as a nation, done a pretty poor job of vaccinating our first Australians. The gap is wide, they are vulnerable, and as we've seen, Delta is here, and unfortunately, in at least 2 states for now, and eventually more, Delta is here to stay, and so these gaps do need to be really addressed.